Chronic lymphocytic leukemia, CLL, is a type of cancer that can take a very different course with different patients. That's why it's very difficult for physicians to predict the course of this disease. Researchers at the Center for Integrated Oncology in Cologne, Germany, have now developed a tool to help physicians with this task.
CLL is actually a type of so-called non-Hodgkin lymphoma. One special characteristic of this type of non-Hodgkin lymphoma is that it always affects the bone marrow at a very early stage, and from there cells are then flushed out into the peripheral blood, which means there's an increase of white blood cells, or leukocytes, which is where the term leukemia comes from. The spectrum of this disease in terms of survival probability is very wide. There are many patients who won't die from CLL and never require therapy throughout their life because the disease is typically detected in older people, while there are other patients who have a short-term survival probability, especially if they're younger.
In collaboration with other universities, the CLL IPI tool was developed here at the University Hospital of Cologne. What's its intended purpose?
The CLL IPI tool assists in addition to the usual prognostic classification, which already provides a rough indication of a patient's survival probability, while it also indicates when a treatment should be started. These calculations are relatively crude, and the CLL IPI tool now helps to provide a better prognosis of survival for this disease.
What prognostic parameters does the CLL IPI capture?
It captures gene mutations of CLL on the one hand. They are extremely important and are among the most significant markers. Yet a serum level like the beta-2 microglobulin or even a pure biological marker such as age, for instance, also play a role in this.
Dr. Yasmin Barlow co-developed the CLL IPI tool. It can be used via an app. Dr. Barlow, what is the Calculate app?
The Calculate app is basically an app that integrates several apps into one. It was primarily developed for physicians or medical personnel or healthcare professionals in general. You'll find a number of different scoring tools or calculators from different areas of medicine, for instance the popular body mass index. The body surface area can also be determined and calculated with this app.
What kind of data does the CLL IPI tool use?
The data set for the IPI analysis included data from randomized Phase 3 trials. Overall, it involved data sets from 8 Phase 3 trials from 5 different countries. This data was transmitted to us via an anonymous data transfer and subsequently combined into one complete data set. In statistics, this is called a meta-analysis based on individual patient data.
The findings from years of research are combined into one compact tool that can be given directly to physicians. What are the benefits for patients?
After calculating the prognosis, one advantage of this prognostic tool would now be to conclude that the patient's prognosis is very favourable and presumably entails an extremely slow disease progression to where this patient doesn't have to see the doctor every 3 months, making longer intervals between visits sufficient, which is reassuring for both the patient and doctor and confirms that it's very safe to monitor in these longer intervals. Conversely, patients who presently feel quite well from a medical point of view, but whose prognosis is not as favourable based on their prognostic score, should be seen more frequently in order not to miss the right time to start therapy before the disease turns massively progressive and might cause complications, for example.
And what are the benefits for the treating physician?
The advantage for the treating physician is that he or she can rely on the collected statistical data. Obviously, your own experience still always plays a role and flows into it, but this assessment actually includes the data of thousands of patients and therefore also makes a far more objective estimate of survival probability or the time left before starting treatment possible for each individual patient.
Thank you for this interview.